I think Mr. or Miss Xin Cheng Xu's mic is on.
Yeah, I think I heard toilet, this kind of stuff.
Sounds like it.
Yep. All right, give us a countdown. Okay. Hello, everyone, and welcome to Luohan On the Air. Today, we're talking about how to handle the third wave of COVID-19 infections. I'm Chen Lei. I'm pleased to be your moderator today, as I have been the past couple of sessions. I usually anchor the global business and biz talk shows on CGTN. And let me introduce a fantastic star-studded lineup of panelists today. We've got joining us from New York, Shangjin Wei, who is professor at Columbia University's Graduate School of Business. He's also former chief economist at the Asian Development Bank. From Washington, D.C., Jennifer Bowie, senior policy researcher at the RAND Corporation. From California, Rafik Dosani, the director of the RAND Center for Asia Pacific Policy. And of course, from Hangzhou, our favorite professor, Professor Chen Long, who is executive director at the Luohan Academy. Welcome to you all. So, it's been more than 3 months since the Wuhan lockdown started. Beijing, most of China has reopened, and other developed countries are easing the door ajar after months of lockdowns. But what about emerging economies? They have weak public systems. They have vulnerable economic systems. So without helping them, how hefty a price will the world pay? So let's discuss this and more with our panelists. Let me start by asking you, Professor Wei. You used to be the chief economist at the ADB, and you've been calling for helping developing nations through this crisis. Why?
A developing country has a very weak public health system in terms of hospital beds, ventilators. They have a shortage of those compared to either developed countries or larger developing countries. They also have, very importantly, a very weak fiscal system, fiscal position. Many of them, they have very high domestic debt to GDP ratio. Many of them have foreign currency, and that they cannot afford to roll out the kind of help to households and firms that we see in the US, Europe, and in China. If we don't help them, if there's outbreak in those countries, eventually they might come back to us. So the risk of having second or third wave will be so much bigger if we don't help them.
But Rafik, what does the data tell us right now? For example, on South Asia, on India, about infections.
So what's interesting is that South Asia was expected to be a hotspot. Poor health systems, lack of universal coverage, lack of resources, exactly the things that Shangjun was just talking about. But in fact, the experience has been okay so far, and some people are attributing that to undercounting, to the fact that this pandemic or the epidemic has not fully had its impact. But it's certainly, the numbers suggest something very different from what was expected. For example, speaking to the Pakistani ambassador a couple of weeks ago, he mentioned that only 30% of their surge capacity had been utilized. And even if you look at the numbers in terms of case fatality rates and the number of infections, it's well below world averages, and they seem to be all right for now. And that's true pretty much across the board in developing countries. It seems sort of looking broadly, Shangjun mentioned health systems. That's definitely been a factor. So that's helped some countries which might be poor but have very good health systems like Sri Lanka. It might be experience with disaster risk management systems. Again, you can have poor countries like Pakistan and Bangladesh through different kinds of incidents of cases, and seems to have come out of it with 0 cases now for many days running. And it could be, as Xiangjin mentioned,
You mentioned the third wave. We certainly have seen that China and East Asia countries have seen the epidemic in February, but in March it was Europe that dominated the increase of new cases, and since early April, U.S. Has been leading that trend. So recently, we do see. Overall, we see the South America and Africa start to have more cases. Right now, Africa represents only about 2.8% of the total case number in the world. However, it's about 5 days, so that's quite quick. And then the Peru in South America also has basically a per capita caseload similar to that of the U.S. So that certainly should be keep an eye on. In terms of the East Mediterranean regions, we do see that Yemen have seen the first case. Yemen has had the hardest humanitarian crisis in the recent years, 5 years of civil war. So any case happening there showing that that's a huge problem. As Rafiq mentioned, several Asia countries are starting to see the cases. Bangladesh actually has a pretty high case numbers in recent weeks. And even though most of the Europe areas, the capacity, per capita case number is coming down, but we do see Russia has surpassed the Germany and France to be the number 5 now. So the yesterday the case number increased by 10,000. So that's also a very fast new phenomena.
Thanks, Jennifer. Professor Chen, given these rather alarming numbers, how should developing nations be fighting the pandemic?
Well, I think before we get there, let's define a little bit of the third wave. So in a sense, we feel that human beings are making the same mistakes again and again. Now we're looking at the Europe and America, but actually, you see, I think the first problem is that China's experience was not paid enough attention, was not learned. So Europe and the US was paying this in a hard way. Now, but this exact is the same problem actually at the third wave, in the sense that if you look at this pandemic, this virus, it actually has invaded essentially the countries that covers more than 99.5% of the countries, of the populations in the world globally. You can see it has already invaded the whole world. And from what we have learned from Europe and the United States, we learned that if you don't do something, actually it won't go away. It will come to haunt you. So just because it hasn't exploded doesn't mean it won't. It will. So this is exactly what we have learned so far in most of the countries, and I think this is coming. But this is coming after actually in a bad way. Because for the first wave and second wave, for the East Asian countries and for the Europe and United States, they actually have certain ability, medical ability and economic stimulus ability. But in this third wave, many countries, the countries in some of the by the debt problems already. So it will be much harder. So when we talk about earlier, we talk about many countries in this first wave and second wave, we care about the SMEs, because those are the small migrant companies that tend to be contact intensive, which is exact opposite to the distancing economy. So they tend to be labor intensive, contact intensive. They tend to have more liquidity problems, and they tend to have weaker government support. And for the third wave, it tends to be this is magnified to the country level. So this is exactly the same kind of problems we're facing. So I think there's no short answer to this problem, but I think that we're just starting to discuss this. We have to discuss this in multiple ways, but let me stop here for now. I think my point here is that the third wave is coming. Actually, yesterday I just read the news that Brazil just had more than 10,000 cases confirmed in a single day. It's exploding. 10,000 cases. The problem is that these other countries are not ready for this, the least prepared for this. So we're facing a long battle. We have to work together for this.
Professor Wei, what do you think of this idea that we keep making these mistakes, and how do we minimize the mistakes we make in the third wave?
I guess one mistake perhaps Professor Chen was observing was, before one sees a big caseload in a country, one tends to think somehow my country is special, or disease special in such a way that my country will not be affected. I guess what experience of Europe, US, other countries has shown that kind of a thinking didn't usually work out well. I mean, there can be countries that are special, but the experience so far says that if one does not take the time, before you see a large caseload, to prepare yourself in terms of getting test kits ready, getting the hospitals and other things ready, you can be surprised in a very bad way. So that's the sense in which the lesson needs to be kept in mind, even for countries, even by country that currently do not see a large case load. In terms of how to deal with this question you asked, Professor Chen, the way I think about this, there are essentially two sets of questions. One is life versus livelihood. Life means there's a medical and public health dimension, what we do to minimize those problems. The livelihood, what we do to make sure that after some orderly social distancing or isolation, that the economy can restart robustly. That's one set of questions. The other set of questions is solution involve national response, but also in international response, right? So nationally, what you can do in terms of financial assistance to households and firms, but also internationally, many countries perhaps do not have the domestic capacity to produce PPE, personal protective equipment, the way China and US can. So they need to have an international dimension to get those things ready. So at least I think there are these two sets of issues that they won't have to think about in terms of a right strategy.
Rafik, this decision between lives and livelihoods, do you think it's more acute in developing countries?
Oh, yes, there's no question about that. I think countries like the United States have the luxury, if you like, of financing for a long time, maybe for a full year, the unemployment of the population. Developing countries like India and the African countries to a large extent do not. And so for them, the choices are really, it's not that stark. They just can't afford it. Right now you have, for example, in India, about 100 million migrants who live at the margins of poverty, who live in the cities, and who are all rushing back home because they have no jobs anymore in the cities. I would like to point out that, the Professor Shang Jin just mentioned about national and international responses to address this issue of poor systems and poverty. My view is there's a limit to how much you can do that. And the limit is because if you don't have good health systems in a country, you have fragile institutions, corruption, compliance issues. The record has shown that you can only do so much. Flooding a country with funds doesn't necessarily buy you a whole lot of time. So I think we're in for a very difficult situation. I always pray and hope that this third wave doesn't come. But in my heart of hearts, I know it's coming. And this is going to be a very difficult situation for the poor countries.
Professor Chen, maybe instead of international aid, we should be transferring know-how.
Yes, I think it's critical. Actually, there's a limit on international support. It's important, but actually, most essentially, I think the governments, domestic governments themselves, they have to understand the nature of the issues. And what we have learned from first two waves is that the faster you move, the less costly it will be. If we look at many of the East Asian countries, So there could be some still room for some of the countries to move fast. Thus far, we have detected a single country that is able to contain the virus effectively without a large economic reduction. You have to essentially have to do distancing. That's very, very painful. And so we just have to understand there's a critical trade-off. And we call this the pandemic economy. Pandemic economy is not the pandemic plus economy. They're intertwined with each other. And the government response plays a critical role. It is a triangle, and hopefully it's not a deadly one. And so that's what we have learned. So the know-how, understand nature of this, and move fast is critical. And sometimes we think about the recovery is. We hope it's if it happens, it's V-shaped. Well, it's not V-shaped. If you look at the best, the cleanest country is China. China is able to quickly shrink, effectively control the virus within 2 weeks. If you look at how the infection numbers, the so-called R0, it goes down very quickly within 2 weeks. But it took, so the economic activity shrink very quickly within 2 weeks by like 60%. But it took more than 2 months. Actually, it's still ongoing to recover. It's not V-shaped. If you think about that shape, but that in many other countries, it takes much longer to have the contraction. It also takes much longer to have the recovery, and that's even worse the case in the other countries, the third wave countries, because it will be. I think the reduction will be still very painful, but because they actually do not have the medical ability to do a lot of tests to track to isolate the cases, it will be much harder, much more hesitant for the economy to recover. Think about China. China has almost close to zero increase of the confirmation cases almost 2 months ago. Still, we are still slowly recovering because we are very careful. Think about countries, many countries, if they still have ongoing cases, if you have very limited ability to detect, to control the cases, then you have been much slower. Then, so that is painful. On top of that, the nature of the pandemic economy is a liquidity shock. So many of the SMEs, the smaller companies, they only have cash maybe to support for a couple of months. If you think about it, you take very long for the economy to have the contraction and to recovery. We're going to see a lot of the problem to understand this. So sharing know-how is critical. They have to help themselves, and they have to move fast quickly.
Jennifer, in your research, what have you found to be some of the best practices that developing countries can take upon? I know that it's all very dependent on each country.
For Asia policy research, has invited ambassadors and consul generals from 8 countries in the Asia area to talk about their experience. And it's fascinating to see the challenges for each country and their solutions. It seems that the South Korea's 3T strategy works. It's a testing, case tracing, and treatment. But I summarized some of the good practice in my name as a TEA, which is, first of all, is transparency and consistent policy. That means building the trust between the government and the public. And I think that's critical for the collaboration between the public and the government to have the consistent expectations and understand the rule. And the E is efficiency, for the government to be able to effectively mobilize the national resources to put in the target areas, either it's testing, either it's tracing, either it's treatment or investment in the vaccine. This need effective leadership. And last one is A, which is agility. Means that the government need to monitor the trend very carefully and be agile in terms of changing the policy. If something not working, quickly changing to another. And if there's a new hotspot comes up, quickly, change the policy to work on that. So I think this T strategy may be the critical components.
Great, TEA, we love acronyms. Rafiq, we have a question coming from Luohan saying that you mentioned education is the key to fighting the epidemic effectively. Do you mean education with regards to hygiene or social distancing? Because Luohan is pointing out that some developed countries, despite good hygiene, they still had very high infection rates.
Yes, what I meant was, and thank you for that question, what I meant is that education counts when you're in a poor country and the systems generally are weak. In that case, knowing what to do, being aware of it, having been oriented to it, all that becomes much easier for a population that's well educated. And then compliance improves. So the examples I gave were of Sri Lanka, a relatively highly educated country in South Asia, and within India, the state of Kerala, where there seems to be a clear difference in the performance of these areas, this one state and one country, with COVID, a much, much better performance, despite everything else being the same. Now, the difference in developed countries is that, yes, of course, we are taught here, oriented thoroughly on what to do. But, you look at the US, I mean, there's been such a resistance to doing what you're asked to do. The lockdown has created a storm of protest by people saying, just outside my home, for example, there was my apartment building. There was a long procession the other day of cars with their windows down and speakers blaring, all heading for Santa Monica Beach a few miles down the road, screaming about their need for freedom. I mean, this is really stupid. These are educated people who behave like this. So education, I meant more in the context of poor countries whose lives are at stake. So in that sense.
So, Professor Wei, given the difference in approach in people's attitudes, how optimistic are you of US-China cooperation on fighting the pandemic?
Well, we need people like Jennifer to make a case about in principle, you think about like Jennifer, Dr. Fauci, and so on. I think there is willingness to at least work on vaccine, medical, public health collaboration in scientific. Past crisis is that when a situation, the crisis requires, let's say, very aggressive fiscal help. Most countries, unlike US this time, tend to be reluctant to do enough. That's because when you use fiscal policies to stimulate your economy, part of the benefits escape to other countries. There's a leakage. So the logic is that when you want to help your family households, when you push out money, what happens is that this tends to make your domestic currency to rise in value relative to foreign currency. So part of the extra money shows up in the form of greater imports of other countries. This feature tends to make many countries reluctant to do enough. So and when you have international collaboration where all countries do the same thing, then every country will feel more comfortable doing this. Right? So that's the thing we learn from global financial crisis and other crises. Larger countries don't worry about this as much. European Union, China, and US do not worry about this very much because they are so large. Imports a small part of this. Many other smaller countries and medium-sized countries do worry about this. So without international coordination, they often do not do enough because they worry.
Because right now we really need to be developing a vaccine. How should countries coordinate and avoid politicization of the process and promote the research as a chance to foster global collaboration? And should the vaccine development and distribution be subsidized? Professor Chen?
Yeah, it looks like the vaccine is really the main way, though we are far from it, but looks like it's the main way to be out. Now, let me come back to the patterns we've learned so far. So, so in a sense that a country's medical and economic ability are kind of still limited. If you look at the Europe, if you look at the United Kingdom, the country that hoped for the herd immunity, which means doing little, it's actually paying a hefty price. Now UK is the top. On top, it's the more than 30,000 people deceased. So it's the highest actually in Europe now. And look at the United States. So both are very advanced countries with good abilities, but then facing the virus.
Okay, we seem to have lost connection with Professor Chen. Okay, we've got it back. Yes.
Okay.
Keep going.
Yeah. So because we because we don't have the good way to deal with this, so I think the distancing is still a main strategy outside of the medical abilities. But unfortunately, so in this sense, come back to what we talked about earlier. The countries should be aware of to understand the nature of this problem to move fast. Unfortunately, the countries are still also appears to be distancing in the sense that they only care about themselves. They are not caring about other countries. But this is really, so this is particularly the time actually need leadership, need for the countries to coordinate with each other, so don't repeat the exact same mistakes and become bigger with a bigger and bigger cost. And I clearly with you that I think that the vaccine is probably the hope, because it looks like the virus can survive in different temperature, different countries, so for a long time. I hope so. For that, we should really coordinate among the countries.
Rafik?
Pharmaceutical companies that have the resources that otherwise do not have a culture of collaboration will not listen to their governments even if they're asked to collaborate. But they've collaborated in a sense at the back end when they've exchanged scientific information, not vaccine-specific information. So I have a different view. I think let 120 trials flourish,
Some of the scientific collaborations already taking place in a way that
Right.
scientists are sharing information in the way they don't normally do. I would suggest on the vaccine there are actually two pieces. One is discovery a effective and safe vaccine itself. The other is producing enough of them in a timely manner to get to enough people, so to build immunity. Both are very important. And the second piece actually. There's a strong case for subsidy. This is an idea that a group of economists led by Michael Kramer suggested. Normally, when you discover something, you do clinical trial, you prove it's both effective and safe, then you start to produce, right? You don't want to produce something that's not known to be safe and effective because they will go waste. In the current pandemic, there's a strong case to be made that we can afford some waste in a narrow sense. In fact, the world will be better off if we can accelerate the production. So for example, there are 110 or so vaccines being tried. After a few months, we'll discover perhaps 25 of them are likely to be successful. The remaining will not be successful. Of the 25, with a few more months go by, you're going to narrow down to 3, 4, and so on. A case can be made that production should start even when you only you have window down to only like 20 candidates or 15 candidates, and if you start to produce all of them, okay, so in 6 months you'll discover only 2 or 3 work, but then you will have enough volume ready to be distributed. Is it worth doing? Normally the answer will be no. That's so much
Wasteful.
waste. But COVID-19 is really special in the following way. International Monetary Fund predicts that in the next 2 years, the world as a whole is going to lose an economic output on the order of $9 trillion. That means every month we delay, will lose something on the order of $370 billion. Then you ask yourself, there's a very different calculus one can do, which is that suppose you start to producing vaccine sooner, okay? So you waste some money, but you gain 1 or 2 more months time to get to a solution. So every 2 months, if you save 2 months, you save about $700 billion. Then you say, if we're supposed to start to produce 15 vaccines right now and discover 12 of them is going to be a waste, how much money would I waste? You do that calculation, they did this calculation, and concluded you lose about $200 billion or $300 billion. And that's a money worth spending in this particular context. But who's going to spend for their money? So there's a case, since this is a truly global good, one can make a case that the world needs to share, all countries, those countries that fiscally are able to afford should share the cost of doing that. So,
Jennifer, you seem eager to comment on this.
Oh, sorry. I'm sorry to interrupt. I thought it's done. But I totally agree with everyone's discussion, and we should collaborate on the COVID-19. And I think COVID-19 is a special case, as Professor Wei just mentioned. We'll see more willingness to pull, because if we were working on the vaccine for MERS, for SARS, then we would not be in this situation today. The reason we couldn't make most of the investment for the vaccine is because the vaccine is not a profit. It would not produce kind of a profit. That usually a vaccine only used once per person. And often if the epidemic is not a global pandemic like this, you only have very limited market. So the global society should come together, not just only for the COVID-19, but also think about the organization and resources pooling, so that the vaccine for other diseases can also be sponsored.
Jennifer, just another question from Ming, saying that you talked about building trust and transparency in your TEA measures. Is that focused on central government or more at the municipal and local government level for developing countries? I guess in the US, we've seen a large gap in what the federal government does and what the state city governments do.
Exactly. I think it should be at every government level, and depends on the political system of that country. In the US, we see that the public reacts more to the local government because the state government has autonomy to make its own policy. So, so I think whoever make the decision need to think about their communications and the transparency and a coherent plan.
A question from Liu Wei to Rafik and Shangjin, which is about in developing countries, there are often gaps in infrastructure and governance, which can hinder the delivery of international aid. How do we overcome this challenge? And what are the roles of civil societies and private sectors?
Well, recognizing this very severe problem, as we've seen in the past, the big donors have tried first to work on systems at the level of multilateral agencies. And then when you look at foundations like the Bill and Melinda Gates Foundation, they tend to work with civil society groups to try and seed a certain set of best practices that they hope can spread more across society. My sense is this is a very inefficient way to do things. It rarely has proven to have worked. And it really across that developing countries have to bear, unless they can figure out their own systems. And you don't have to be rich to do it. I give the example of Sri Lanka as a country with excellent education, healthcare. So developing countries can be the sites of multilateral agencies coming in and saying, take this and it'll work. It's not a medicine.
Besides civil societies, private sector has an important role to play as well. Both private sector in countries with lots of PPE supplies, like China, US, as well as in the recipient countries, right? So taking the PPE, personal protective equipment is an example. China is the world's largest producer and exporter so far, but we know from media reports, and partly because most of PPE products are low-tech products, the shortage has caused many firms that previously didn't produce PPE now produce this PPE, which means there's a huge variation in the quality of the products produced. And we read the stories in South Asia, and Europe and so on about sub-quality this. There are a lot of good quality produced as well. The problem is many buyers in emergency, they will just want to get hold of anything they can get their hands on, cannot tell the quality, right? So I look at Professor Chen Long, I think about Alibaba. So Alibaba actually has an interesting innovation. So normally, my understanding is Alibaba.com normally it's a platform. It does not directly be a buyer and seller. In the case of PPE, Alibaba.com decided to step in and create a direct sale operation that you will buy from quality buyers in those, from the history of the sellers, manufacturers. Alibaba is in a position to be able to tell good quality supplies from bad quality supplies. Alibaba has the reputation that buyers can trust. So it steps in so that buyers will sign contract with Alibaba.com, and Alibaba.com will ensure quality supply.
And actually, to the Alibaba, if you look at Jack Ma, actually, Jack Ma at a very early stage already, I believe he's the first one. At very early stage already started to send the large amount of the masks and other medical support to all the African countries, because at a very early stage, I talked to him and he already knew that this is coming. And we're already actually at the very early stage of second wave, we know that it's coming for those, especially the African countries. So that is one thing Jack Ma has been trying to do. And we also set up this, in addition to the medical support, the actual the equipments that this Sanjin just talked about. We also actually set up a website that can help actually organize the experience, the medical staff from China. They actually can provide consultations to globally to many countries. So that is exactly sharing know-how. Another thing I think Jack Ma did is to wrote a pamphlet for the doctors and nurses on how to deal with this several months ago, to put it online. So sharing knowledge. So we kind of we knew that we have to share the knowledge to channel the medical support very early to these vulnerable countries. On top of that, I think another thing we've learned that we can use the technology to actually build trust. If you look at in China's case, so we actually use the internet, to share a lot of the informations to deal with the crisis. That in that sense, that since we know that each other, we are in a relatively good, we come from relatively healthy regime, so we can contact each other. So we use the technology to actually build the trust. That becomes a practice in China.
And Rafiq, how do you align the US's healthcare now, economic and security interests when it comes to dealing with China?
So the situation is that the US is currently has discovered what a poor health security system it had. And it's pretty reliant right now on China and mostly on other countries, particularly for equipment. And the mood and the backlash that's created here is immense. There's a feeling that this should never ever happen again. And so it's preoccupied with its own problems. It's funding a lockdown that's still not yet over. And its mood towards multilateralism, in any case, pre-COVID was already poor. So the attitude towards collaboration has just worsened with COVID. And this is all being furthered by bipartisan politics, which for a change have come together on exactly the wrong issue, which is to not collaborate globally. So no matter what people, individuals write lovely letters, as Shangjin mentioned earlier, but the politicians will not listen. There's a bipartisan consensus that we have to go it alone and solve our own problems. So I see the US as coming out of this and collaborating less rather than more.
Professor Wei, is this your read as well going forward?
There's certainly a danger of this. Although, I mean, not everyone within the U.S. public sector has a common, has a unified voice. There are people, certainly the public health officials and so on, are arguing for stronger collaboration. I recall at either the first or second White House briefing on COVID-19. In fact, I think either the CDC official or some other scientists pointed out that Chinese CDC and US CDC talk quite a bit. If the Chinese CDC apparently informed the US CDC on January the 3rd, they also pointed out the very rapid sequencing of the virus DNA. Partly because many of the scientists were trained in the US. They said that, someone talk about someone from the US CDC pointed out that there were a lot of like a mutual visits of Chinese scientists coming to US CDC in the past. They get to learn some of the things that actually also help China to act fast and also allow the Chinese scientists to have a relationship with the U.S. one. So I think they see productive collaboration, success of productive collaborations, and they see value of continuing that. Whether those things can, overcome politicians' other considerations, we don't know. But I guess I want to point out there's no necessarily one unified view, even within the public sector.
Yeah, nothing is monolithic, of course. We have a question from Luohan to all panelists, saying that developing countries, of course, have challenges due to less prepared health systems, limited resources. So considering these first and second wave countries' experiences, what are the minimum strategies, the least resource demanding policies that developing countries can take? Who wants to go first? Any hands?
I can do the first step. Yeah, very quickly. I think, the social distancing policy is the only one we have now, given that we don't have the vaccine, we don't have the treatment, effective treatment yet. And among all the non-pharmaceutical interventions, there are some would need resources like testing or case tracing. These are actually need a tremendous resources, both technology and manpower. So the ones that doesn't need these would be in two camps. One is basically close down everything, reduce the contact mix. The other one is to reduce the effectiveness of transmission, which is wearing face masks or physical distancing and disinfections. So it seems that usually when government panic or when they feel the case number goes up quickly, all they can do is close down everything. That can be effective, but to switch that.
The conventional wisdom is testing. So many people have pointed that out. I'm not so if we get enough test kits available in developing countries and can make them extremely cheaply. Certainly, it would be very ideal to not only test a lot of people, but test people repeatedly, right? So it's an ongoing, evolving thing. But what if test kits will not be made available on a large quantity or cheap enough that enough people will be to do it? I think that there we need to think something unconventionally. I think the U.S., in fact, and perhaps Europe, arguably. Might not have pursued optimal strategies, so that even the top health officials like Dr. Fauci and so on, typical mentality is that when you have a suspect, you have a limited testing kits. What do? You use them only on people you suspect to have a virus, and then you confirm, right? So that's how you conserve the test kits. That's the conventional view. Their view arguably is wrong. Arguably is counterproductive from society point of view. Society's goal is not about, the hospital goal is to make sure the person who shows up in the hospital actually has the disease so I can provide the right treatment. Society's goal is to reduce the rate of transmission to be so-called R0 from above 1 to below 1 as soon as possible. Given that goal, how do you use limited test kits? The answer is you do not use it on people who are suspect to have a problem. If people have a symptom, you don't test them, you isolate them right away. You test them, you conserve the limited kit tests on people who have no symptoms. In fact, then you can discover people which subset of them have problem, and you isolate them as well. So people who have symptoms, isolate them right away. This is the fastest way to get the rate of transmission to be below 1, and that's the thing you need to do when you have limited testing capacity or testing kits. We may not need to go to their route in a developing country if it turns out that testing kits can be made very cheaply, but we cannot rule out a possibility that many countries will suddenly they will be in the same kind of situation the United States did find itself in 6 weeks ago, or Europe did 7 weeks ago. Then we shouldn't actually repeat that strategy. So I think the conventional strategy of testing people who have symptoms, in fact, is not the most productive way to go.
Rafik?
Yeah, I just wanted to add one point, that the only resource that's in plentiful supply in developing countries is health workers. So that's, they're reasonably well trained. It doesn't require a lot of training to do contact tracing. Everything else is in short supply: equipment, hospital infrastructure, funds. So what we really need to do, if the multilaterals want to have an impact, is really try and think through, how do we address countries which have this sort of situation? There's one kind of surplus and everything else is in deficit, and come up with creative solutions for that environment. I don't know the answer to that, but I think that's the only way forward.
Okay. Professor Chen, your take.
Yeah, I think the testing has never been sufficient in most countries. You look at the death toll as proportion of the confirmed cases, they are just vary so much across the countries. What this really says is that a lot of people with the virus are walking around. So look at the United States, Europe, many countries. So I think the most effective one still is the distancing. And the earlier you move, the better, the least costly. But actually, there's the response has been very varied, because people kind of underestimate and do not understand the nature of this pandemic economy. Yesterday, I read the news that Brazil will start to have a small portion of the Brazil will start to have the lockdown this week. So this week we're talking about, and that's after they have one big case of more than 10,000 people confirmed. So I agree with Jennifer that the distancing is still the most effective one in any country. So that's the first part. And on top of, and I think, you see, we already see the countries varies a lot. For example, countries like India, if you look, we are coming up with a global pandemic economic tracker from Luohan Academy to track every country, actually using the big data. And you can see that many developing countries are already moving fast to some degree. For example, India actually already has its normal traffic, normal the interactions done by 40% of the normal level. So it has a lot of lockdown already happening, but in some other countries, not the case. So even though we do not have enough testing, we actually can somehow get to know the progress of the virus, the effective control of this. A couple of the key numbers. One number is the And one number is the how many days it takes for example, the death toll to double. If it is more than 10 days, it means it's not so fast, But if it's it's a couple of days or 1 day or two, so that means it's really growing exponentially. So even though you do not have to test, you can count people who died, So in a sense, how fast this is spreading. That's a key number. And a second key number is how much slowed is the people's interaction. That's the lockdown part. That can actually also be tracked in many of the countries. So those are the kind of things. So if you want to focus, firstly, we have to using the social distancing strategy a lot in any country. It has been proven to be the most effective strategy, unfortunately. And that is especially the case for the third wave countries. Second, you can actually track some of the key numbers to see how effectively the virus is, how effective is distancing and its impact on the virus impact. So those are things that can help you to know where we are without enough medical ability.
Rafik, a question for you about India. Research showing nearly all the hotspots in Mumbai are in or around slums. So how does the government protect those who can't afford social distancing in countries like India?
So the government has been very severe in its policies towards slums. They've really just locked them up. So people can't come in, people can't come out. My mother lives in Bombay, close to one slum, and she has domestic maids who come from the slum. They've not been able to come out for the last several months because they're told if you get out, you won't be allowed back in. And that continues to this day. So, countries like India are managing through draconian measures that have completely made the economy so fragile as a result, because, these domestic maid servants earn about $100 a month. And costs are not that different from the US. Housing is actually more expensive there. They just manage on the margin.
I saw the latest PMI number falling to single digits in April. Yeah. It's horrible.
So it's a really difficult situation. And for such people, we really can't say or educate them on good practices. It doesn't make any sense at all. If you're going to die if you don't get food in a day or so. And I see that as being the big problem in places like India.
So that's just something we have to accept? Is it something the international community can do? Or not really?
Well, that's why public sector help is very important. It has to be a necessary complement to social distancing. You cannot just, physical isolation is not enough. Like Rafi pointed out, people can die without food. So you need also making sure there's a physical isolation, but also timely help to households to make sure people don't die from loss of income. So that's very very important. The world as a whole does not have a shortage of food. There's no physical quantity of a food shortage. In the U.S., we have we story about people get rid of meat and others poultry because they don't have the manpower to process. That means there should be a way to we should work on making sure at least in times of emergency, using some non-market, non-price mechanism to make sure households have the food, households have the help, and this will complement this social distancing policy.
But Sanjan, if I may bring up the point that Amartya Sen's famous study of the Ethiopian famine of the early 80s, where mountains of food, shiploads of food were sent from developed countries to address the famine, and
countries with their economies.
It varies from country to country, but since you mentioned about debt, so there's a domestic debt piece, there's an international debt piece. The domestic debt piece is relatively easier to address because domestic debt is about one part of society owing money to the other part of society, and you have a central bank, you have your treasury, the central bank can, in emergency can even if you monetize the debt on a temporary basis, not the end of the world. The international debt piece is a bit trickier. You need the creditor country to help. In this case, in fact, China has a potentially very important role to play. China has, in the last few years, become one of the largest creditor countries for very developing countries. And China has also, even with a decline in overall foreign assets, still has relatively large foreign asset position. So this is a time where I think that China can offer to have a debt moratorium, so people don't have to pay. Countries in poor fiscal position need not pay the debt or the interest right away. You can give them 2 years or 3 years of a grace period that China can afford it. Other countries will benefit. And in the end, these are the kind of things in very concrete ways that people will appreciate. The role China will be playing. But it's not just China. Many other countries are creditor countries. All creditor countries should. Most creditor countries, of course, are richer than China, so they should be more able to afford this. There are also, World Bank, ADB, IMF, multilateral agencies certainly can, and they are already, many of them are already doing this to offer longer grace period for country in debt to sort of tie over this time of a crisis. But I just thought I will specifically point out a potentially very useful role that China can play. They will also win a lot of goodwill for China in the months and years to come.
Professor Chen, how do we help developing countries' economies?
Right. So I think as we already talked about, they are like the SMEs. They are more vulnerable, and what we have learned that, and also time matters, because the longer it takes, actually, the more destructive to the economic and the financial infrastructures to the economy. That could be that actually make a difference between a short recession and a depression. And so that actually means that it's the earlier we can help them, the better. And the help, I think, in 3 ways. One is that it's a know-how talk about, to understand the nature of this, to move fast, to reduce the cost. And that I think still is the most, probably most critical one, because the domestic efforts matters, and people have to have the right perception. And so that's the first. The second is the medical support. It's all kinds of medical support, from equipments, masks, the consultations, and so then it's the economic help, and economic help, and it's inevitable that I think the third wave countries, they are going to take much longer to both in an economic contraction and a recovery, and actually all the institutions, companies, individuals they're relatively more vulnerable. And so they're going to facing the same liquidity shock when it takes longer. On top of that, they are more vulnerable. So actually, they're going to have bigger shocks. And if that shocks really it's very destructive to the economy, then it takes not much longer. Then it come back, it will haunt the whole world. So help the world is helping yourself. So in this sense, then I think we just have to seriously think about all kinds of the supports. The financial support, the delay of the debt burdens, this or that. Just like look at how domestically a lot of the countries, how they save their companies, individuals. It's the same principles that can be applied, but that requires the coordination through the international institutions, and also through the coordination between among the countries. It also needs the leadership. But this is very complicated because it's a burden on the whole world. And in this sense, it becomes very clear that we have to collaborate with each other on all the 3 fronts what we just talked about.
Do you see that happening, Rafik?
Well, you've heard my tone of skepticism through these set of questions, but no, I agree. Actually, I think there's something that can be done here. There should be no free lunch, no moratorium of debt, saying just moratorium and give you some time. It should be closely linked to a package of governance reform, and very strict governance reform in the way that countries get imposed on by the IMF when they're in trouble for bad loans that they're stuck with. Here it's a bad pandemic that they can't deal with. You want out, a very strict governance reform program, along with some help financially on debt moratoria. And that sort of reform should cover health systems, it should cover governance, it should cover distribution. And of course, it should provide equipment to overcome shortages. I think that sort of thing is what might work.
I've got a question from Patricia. How does the pandemic change the trend?
For a while, we've seen that the funding for public health has been decreasing. For both US, China, CDC, we have seen the less funding on these. And we talk about epidemiologic transition, that is, the infectious diseases is no longer a dominant problem, that chronic diseases and aging are the most, cause most of the disease burden. So this, I think, pandemic will change that perspective, that we again seeing how infectious diseases can affect the world economy. But for developing countries, I think it will be a blow. And I would also talk about this is a first and for all, is a humanitarian crisis, and especially for places where the healthcare facilities and resources is limited. The COVID-19 can quickly overwhelm the healthcare system. So those who are affected is not just the COVID patients, but it's also the patients who need healthcare, who has the cancer, who has the trauma, who has the diarrhea, that need healthcare, that will be suffering from this. So this will really wreck the healthcare system, and it will take quite a lot of resources to save it.
Professor Wei, globalization. Do you think developing countries are going to suffer from this trend towards regionalization?
One thing we learned from the pandemic is this, right? In the past few decades, multinational firms, high-income country, low-income country have all been told to reorganize themselves to pursue ever greater efficiency. But what pandemic tells us is that efficiency is not the only thing we should care about. Sometimes you also need to pay attention to resilience, robustness. That is, one should be willing to sacrifice a bit of efficiency in exchange for, greater resilience to big shock like this. In more concrete, and governments will learn their lesson, and company will learn their lessons, just in case, something like this pandemic or lockdown happens. Governments will ask themselves similar kind of questions. So you're going to see more attention paid to those resilience-induced diversification strategies. I want to say this is actually very different from the so-called decoupling strategy. So this strategy doesn't necessarily lead to, causing US to decouple from China, causing US to get China out of the global trading system, but more likely we're going to see China +1, China +2, China +3.
Multi-shoring.
Kind of a strategy, and that's probably okay. China probably will do similar kind of things. So these are the things that will happen anyway, naturally. But beyond that, there are other things that are not predetermined. That's very much depending on policy choices country make. There is a voice in the US arguing for decoupling with China. It's not a unanimous view, and currently I think it's unlikely to be supported by US corporate sector as a whole, but the voice is getting stronger, and some of the US firms may be subscribing to this. It's hard to think a majority of US company will subscribe to their view, and that's because most US firms realize that their true global competitors are other German firms, other British firms, other Japanese firms. In most sectors, a few sectors are exception, but most sectors, the true competitors are not the Chinese firm, unless you can have German firm, Japanese firm do the same thing. If you yourself switch out of the most efficient suppliers to buy more expensive inputs, you're going to lose global market shares to your true competitors. And this is something that US companies are unlikely to be supportive. So I think that the logic of economics and commerce would suggest not something that easily can be sustained. So that's my view.
But Rafiq, what about countries that currently rely on having low-income labor as a comparative advantage? How do they lose out in this regionalization process or China Plus process?
They would lose out. So I do think that there will be some effect on globalization. It will reduce. There will be an increase in regionalization. So I think that was a good question. Absent the US, most countries recognize that a pandemic is precisely the time when you need more collaboration and not less. And they are practicing that, Now, coming out of this epidemic, how will countries align? I think for most regional blocs, except for a few which don't get along well, like in South Asia, but ASEAN, SCO, FOCAC, which has got China in it, but African nations, Mercosur in Latin America, these are groups that can effectively help each other much more in addressing health emergencies. So I see, that the economic side would probably continue as before. It'll be a global world.
Have to survive until the pandemic somehow is over. And internationally, it's similar the case. So I think that it makes a lot of sense. Now, there's essentially, I think, a global consensus for governments when they have the ability to deal with this. And that includes the international institutions, IMF, World Bank. So for surely they can actually, and they are doing things. And so there's no easy answer for this. It will be very complicated, and there should be certain, there shouldn't be just free lunch. There should be certain ways to make this efficient, to help the countries and to benefit all around. But I agree that international institutions, the debt, the payment, etc. And I think both the international institutions and also the countries, the debtors, the lenders, they have to find a way, because to help the countries, and it's helping them is to just help yourself. But it's not just about sending out cash or this or that. They just have to work things out. And also for China, so you see globally, we are at a time that essentially the world is in some kind of the reorganizing, of the economic orders, and we always need the leaders at such a time for globalization. So I think the China can. So I come back to the earlier question. I agree that I think globalization has benefited the whole world. We can argue that the Industrial Revolution was was led by the globalization, and the emerging markets including China, a lot of Asian countries, where many countries are the beneficiaries of this, and the benefits is beyond a doubt. And I think it will continue, but it will shift. It will relocate domestically and internationally. And at such a time, it's a disruption of the traditional way to do it, but it also brings a lot of opportunities. And at such a time, you need leaders. And for the international institutions, including the countries like China, many countries, they can become leaders. We need leaders. So they can, at such a time, you just have to find the ways to help them. Then if you're helping them, actually, so essentially at such a turbulent time, we're looking for new coordination ways, new supply chains, new ways to do the globalization. So I think in this process, we can consider including the financial support, economic support, other stuff. So that's happening at the same time.
Professor Wei, what about this settling in the yuan?
Well, in order for other countries to buy PPE and medical equipment from China and settle in RMB, it would require those countries to have RMB. There aren't that many countries. The RMB circulating outside China is very small in value. Therefore, at this moment, you cannot do this. You cannot do this. The way this could work is that those countries simultaneously also ask for a loan or get the loan from Chinese banks in RMB. Then you have a loan in RMB from Chinese bank, and you can use it to pay for the medical products or PPE. So that can be technically arranged. But of course, whether this is something that can that is economically sensible to do, you have to do that analysis, that sustainability analysis for the borrowing country, and China as a lender or the banks as a lender need to do analysis as well. So it's not something that can be automatically done, but for a country that has a need and has decent credit, maybe that can be done. But here, international organizations can be brought into the picture. So countries in need normally go to international organizations for loans, not just because international organizations are set up for their purpose, but also they can do their sustainability analysis. They can impose, governance reform conditionalities that Rafiq mentioned, a typical loan program from IMF or World Bank have many other conditions, so-called conditionalities. And multinational institutions are in better position to do such thing than China or other bilateral creditors. So we should think of this in a trilateral way. So some international organizations can make loans, and they will be inclined to make loans for medical emergencies, and those loans can be used to purchase PPEs and others.
Okay.
Sorry.
Mm-hmm.
I just want to add one word. So in other words, a crisis actually creates new opportunities, new ways to do things. So that's precisely the time you can try new things. I guess that's a short answer to this.
I've got a question from Xu Xingcheng. I'm going to address it to you, Rafiq. Many developing countries are now looking to countries like China, US, and Europe, for leadership, especially in the global revival to come. Is there impact on global leadership from this pandemic, and how?
Well, you would have hoped that there would have been some collective wisdom here with countries that had adopted early strategies that succeeded, being welcomed and praised and studied closely for what they did. I think in some ways, for a very Western-centric developed world, the early successes were in East Asia, not just China, but also other countries there, Japan, Korea, and across the Strait, and then also in Singapore after a little bit of a hiccup. Those cases were not studied, and it tells us a lot about the state of thinking about collective leadership, your basis for collective leadership. And I think that can be powerful.
Being in the US, Jennifer, your thoughts on that? This whole, whatever China does is terrible kind of narrative.
So about the U.S.-China relationship now, I think in a way efforts will certainly get the respect.
Do you want to come in on this, Professor Chen, on global leadership and how it changes?
Yeah, I think thus far, sadly, there's a lot of sign of the lack of the leadership and the coordination. But I think we are still at a very early stage, trying to find their footing. And so, but gradually we just have to find a way to reorganize the way we deal with the pandemic and also the economy. So there's still a lot of it's challenging. Thus far, I agree, it's not very optimistic. Well, don't learn from each other, actually blame other countries. This is it's not very good, but I think we're still early, unfortunately. And so there will be more challenges, and there are many more, and until we find a collective way to deal with it, and I think it will gradually probably come. There's a lot of uncertainty, but it's still early. Many countries are too busy with their domestic chaos. Yeah, but we definitely need the leadership for collaboration.
Okay, we're just coming to the concluding thoughts. So actually, I do want to hear from Professor Wei about global leadership. So I think that's a very, very important point.
Well, the current U.S. administration has been foregoing leadership in many areas, sometimes explicitly, sometimes implicitly, which is very unfortunate. And this pandemic is not that different. On the other hand, certainly in scientific area, I think U.S. will continue to maintain leadership. You know, if you ask yourself which countries are more likely to produce, you know, the vaccines and produce enough of them, have discovery, you know, in helping with public health, and I think you know, it's hard to imagine U.S. not being a leading position in that. So the question is whether U.S. on the political side will take up its leadership role and you know, interpret America first in a broader, more enlightened way, and you know, maybe coming November we might see some difference.
Okay, so we've got 5 minutes left, 1 minute each. Rafik,
let me end on yes, thank you.
Yes.
Thank you. Yeah, let me end on an optimistic note. You know, I was a venture capitalist in Silicon Valley while teaching at Stanford in the early 2000s when the dot-com crash hit, and at that time Google had come looking for money with a valuation, as we called it in the trade then, post money of 400 million. You know, now it's worth over $1 trillion. My VC firm passed on it saying, what is this? It's a really bad environment, and you know, Yahoo's got the market anyway. It was a huge mistake, and I could have retired long time back had I not been so stupid along with my colleagues. But the point I'm trying to make is that this was a very difficult time in which some of the best innovation took place. Today, the pandemic offers a similar opportunity. You know, Silicon Valley firms are struggling right now because they don't have cash, but this is exactly the time when they're becoming the most creative, learning how to do new ways of work in a remote environment, while, you know, learning how to be very creative in this environment. And I've been in touch with some venture capitalists on this issue in recent days. So my hope is that, yes, the brains of humanity, wherever they may be located, here in Silicon Valley or somewhere else in China, will come together and find solutions that at this point, we can only speculate about. We don't really have a clear idea, but I'm optimistic about that. Thank you.
Jennifer?
I really like that very positive view, and I want to support that and to say that COVID-19 is basically has ruthlessly reviewing the weakness of every healthcare system and every governing system. So the silver lining of that is the aftermath of this crisis. I'm sure we'll survive this, but then it will be a reflect and rebuild time.
Great. Professor Wei?
I think you know, COVID-19 has moved firms, factories, schools to a new mode of operation. You know, perhaps against the previous habit and resistance. Some of us have discovered that there are actually efficiency gain. There are also benefits associated with this more online type of life. For example, take the example of education. Before a pandemic, maybe at a given point in time, maybe 10,000 physicists around the world are teaching basic physics. 10,000 economists are teaching basic economics. Perhaps we don't need that many people teaching similar kind of things for the first years. We find a way to harness that kind of innovation, a new way of doing things. Perhaps something good, something more productive will come out of this pandemic experience.
Professor Chen?
Yeah, I think today's topic is the third wave. I think the third wave is coming, and this wave is marked by more vulnerability. And we can see that we're still making the same mistakes, and it probably take a very long time to cope with this. But that's precisely the time that needs.
Its attitudes to global collaboration are murky at best, and may get worse after the pandemic. Social distancing is still the easiest way to fight the pandemic, but we can perhaps more effectively allocate our limited testing kits to asymptomatic cases. And the fact that health workers are in large supply in developing countries may be something that we can work with. And we could also use big data to assess the efficiency of distancing policies. We need to work on helping people in the slums, people who are very vulnerable, perhaps versus non-price, non-market mechanisms. And